my name is Nicole Perazzo, and this is Bliss. Bliss has agreed to have an assessment done on her. Bliss, can you just repeat after me? Bliss, agreed to have this video uploaded to Olivet University
Agree to have this video uploaded to Olivet University
and participate in this video. Okay, so we're gonna go ahead and scan the room. I'm gonna go ahead and show my note card. Okay, first off, I'm gonna start the exam. I'm gonna go ahead and wash my hands. And first thing, you want to introduce yourself to the client. Hi, my name is Nicole. I'm going to be a nurse. I'm going to be doing a full head to toe assessment on you. Okay. First, we're going to go ahead and start off with the anterior part of the chest. So we're going to inspect, watching breathing. We want to make sure there's no accessory use of muscles. We're watching her neck, making sure there's no distension, anything like that. Making sure she's not labored. After we inspect, we're just going to palpate. So we're just going to feel in her chest. Notice for any ear trapping. Go ahead and move your hands. Okay, next then we're going to go ahead and we are going to auscultate for her lung sounds, okay? But before that, we're going to actually do tactile fremitus, and we're going to use the ulnar surface of our hand. I'm just going to have you say 99 every time I move my hands, okay? Go ahead.
99, 99, 99, 99.
Good. Next, we're going to do chest expansion, so I would just want you to breathe in and out. Good. This is of the T10. You want to see symmetrical movement, which Bliss has. And if there wasn't, it kind of indicates if there's any kind of pneumothorax, anything like that. Next, we're going to go ahead and auscultate for lung sounds, starting at the apex, which is above the clavicle. Listening for any bronchi, wheezing, any rales. Listening bilaterally, making sure that lung sounds are clear, which they are. And here we just move the breast aside, and we're listening all the way to the bases. Good. Okay, after that, we're going to go ahead and assess Bliss's carotid pulses. So here I'm just going to move your hair. We're just assessing and palpating right here. No masses, tender. Any pain?
Nope.
No. And here we're going to listen for bruise. You listen on both sides. After that, we're going to go ahead and finish our cardiac assessment. So again, we're inspecting, looking for any heaves, thrills, lift, anything like that. We're going to palpate the 5 cardiac markers. So this is the aortic, pulmonic, Erb's point, tricuspid, and mitral. And here we're in the 5th intercostal. On the left side, we can feel that the PMI, which is the point of maximum impulse. Okay, next we're going to go ahead and auscultate with the bell and the diaphragm, the 5 points. So the aortic, pulmonic, Erb's point, tricuspid, and mitral. And then we're going to go ahead and do it again, aortic, pulmonic, Erb's point, tricuspid, and mitral. And here we're going to listen for an apical pulse for 30 seconds, which we have a stop timer for. So we have 40 beats in 30 seconds, so that'd be 80 beats. There's no S1 and S2 were auscultated. There's no S3, S4, any gallops, murmurs, any adventitious sounds. Next, we're going to go ahead and we are going to move to the posterior side. So Bliss, I'm going to have you actually turn this way a little bit. Same thing, we're going to go ahead and inspect the skin, make sure there's no tripoding, any difficulty breathing here, using any muscles or any extra muscles for breathing. We're just going to inspect the skin, notice the color, temperature, moisture, notice any ear trapping, anything like that. Next, we're going to go ahead and do chest excursion again in the back. Go ahead, breathe in and out. Okay, good. So we're gonna wanna make sure which is symmetrical for this exam. After that, we're gonna go ahead and we're going to do tactile fremitus again. So I'm gonna have you go ahead and say 99.
99, 99, 99, 99, 99.
And here, test for any hyperresonant sounds. Next, we're gonna go ahead and percuss. So we're gonna listen for any dullness. And this is for any hyperresonant sounds. Good. After that, I'm going to go ahead, before we listen to breath sounds, I'm going to go ahead again and watch her breathing, and we're going to use the timer again for that. And same thing, we'd be watching any accessory muscle use, anything like that, any pauses, any apneic breathing at this time. So she's breathing non-labor. And that stopped. And she has a rate of 14. Next, we're going to go ahead and auscultate. So we're going to do all lung sounds, starting from the apex, going to the bases. Just same thing, listening for any adventitious breath sounds, listening for wheezing, bronchi. We want to move side to side so we can compare. Good. Next, I'm going to have you, every time I move my stethoscope, we're going to test for gophony. Go ahead and say E.
E, 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 E.
Good. Next, we're going to test for bronchopnea. So I'm going to have you say 1, 2, 3.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Good. Okay, next we're going to go ahead and test for whisper pectriloquy, and we should not be able to hear at this time. So go ahead and whisper 1, 2, 3 every time I move. Okay, that is good. Next, we're going to go ahead and finish our cardiac exam, and we're going to go ahead and lay you down, okay? So here, you can go ahead and lay your legs down. We're going to go ahead and palpate heaves, thrills, or lifts, again, in the 5 spots, the aortic, the pulmonic, Erb's point, tricuspid, and mitral, and again, we can feel the PMI. Then we're going to go ahead and auscultate with our bell and diaphragm, the aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm going to go ahead and flip it. The aortic, pulmonic, Erb's point, tricuspid, and mitral. And here we can also test for JVD. So I'm going to go ahead and press on Melissa's right side. Go ahead and look to your left. So you can press down. This is called the hepatojugular vein distension. We want to make sure that we can see that right there. Good. And then we can also assess this. I'm going to go ahead and tuck this pillow underneath a little bit so we can do a measurement for JVD. We want to make sure that it's less than 3 centimeters. So we go in the suprasternal notch with our measuring tape. So I'm just going to feel right here. Less than 3 centimeters. Great. After that, we can go ahead and move to our abdominal assessment. So here we're going to go ahead, I'm just going to lift up your shirt a little bit, and we're going to expose the stomach. We want to notice, excuse me, we want to notice the contour, the belly button, if there's any tattoos, bruising, anything on the umbilicus area. So there is a noted belly ring here. There's no hernias noted. It doesn't look like any obvious deformities or anything like that so far. We're also noticing we'll get further on the color, temperature, notice the moisture of our skin as well. First off, we're going to go ahead and auscultate for the arteries. So the first one is the aortic, and it's going to go above the belly button. The renal arteries on both sides. The iliac arteries. and then the femoral. And no breweries noted. Next, we're going to go ahead and start from the right lower quadrant and listen for vowel sounds. We want to make sure they're not hypo or hyperactive. She's having great sounds. So with the left upper and right lower. Next, we're going to go ahead and percuss for lung, or for not lung sounds, for abdominal sounds. So I'm just going to feel some tapping. Here we listen for any tympany, dullness. Good. Next, we're going to go ahead and do palpation. So it's going to be light and deep. So I'm going to go ahead and press on your stomach a little bit. Let me know if there's any pain. Here we're feeling for any tenderness, rebound tenderness, any pain, any discomfort, any edema. We could feel any fluid shifting here too. Next, we move to deeper palpation. So here we really want to feel like the organs. So you start with right lower, right upper, left upper, and left lower. And then after that, we're going to go ahead and percuss for the liver, which is on the right upper, which is right tucked underneath the lung. We can help find that by doing some percussion as well. Good. And then the spleen, we can feel a little bit duller sounding on that side. Any pain? No. Okay, good. You can go ahead and put your shirt up. I'm going to have you sit up. We're going to test for CBA tenderness. So I'm just, this is to test and see if there's any kidney problems, anything like that. If I'm to tap on it and it hurts, kind of indicates if there's anything going on in the abdomen. Good. Is it any pain? Nope. Good. Okay. After that, we are going to go ahead and move to our range of motion exercises. We're going to assess the joints. So plus I'm just going to have you face here. So first we're going to start off by inspecting our hands. Notice any joint deformities, the color, if there's any edema, swelling, tenderness while you're doing this. We can also note a cap refill of less than 3 seconds in each hands. We're also going to do radial pulses, which are great and strong, +2. Okay, good. Next, we're going to do some range of motion exercises, so I'm just going to have you mimic my motions, okay? Okay. So here we're going to test for flexion, extension, hyperextension, and then we're going to go ahead and do abduction, adduction, some opposition. Good. Next, I'm going to have you squeeze my fingers. We're going to do strength, squeeze, squeeze, squeeze. Good. 5 out of 5 for that. Next, we're going to go ahead and move to wrists. We're going to feel for any pain, tenderness, redness, anything like that. Go ahead and we're going to do some more exercises. So we're going to do flexion, extension, hyperextension. Good. You can go ahead and rotate your wrist, fingers flat. We're going to do ulnar deviation, radial deviation. Good. After that, you can test the wrist too also and have your hands like this if she's having any pain or anything like that. Notice any of the carpal tunnel if that was a concern. Next, we're going to move to elbows. We're going to palpate for any masses, pain, tenderness here as well. Good. Any pain? No. Okay, good. So we're going to go ahead and do more exercises. Flexion, extension, hyperextension. Good. Okay, no pain with that? Nope, no. I'm going to have you lift up your arms again and then pull towards you. Good. Pull. Good, good, good. Next, we're going to go ahead and move to the shoulders. So same thing, noticing any pain, tenderness, swelling, the color, temperature, moisture of the skin. Good. For these exercises, I'm going to have you go ahead and do flexion, extension, hyperextension. Good. Bring your hands to your shoulder blades on top, internal rotation. Bring them to the bottom of it, external rotation. Tee out your arms, that's abduction. Adduction is toward across the midline. And then just make some circles. Good. And then while your hands are actually teed out, I'm going to have you press up, press down. Good. Hands at your side. And I'm going to have you push out your arms. Good. Testing shoulder girdle and shoulder strength at this time. After that, we are going to go ahead and move to our light touch sensitivity. So that we are going to use with, we can either use with a cotton swab or something you can do sharp or dull at this point. So I'm just going to have if you can feel this on your extremities. Yes. Is it sharp or dull?
That one's sharper than the other side.
Okay, that's dull. Okay, we can do the same with the lower extremities too.
Hard, soft, hard, hard, soft.
Good. After that, we can go ahead and move to a test called stereogenesis and then graphthesia. So stereogenesis, whenever you close your eyes, I'm going to go ahead and have your hands on your lap, and can you identify this object in your hands?
A plug,
Yep. Other hand.
a pen,
Good. After that, we're going to go ahead and move to vibratory sensations. So I'm just going to have you have your hands on your lap, and you're going to let me know if you can feel it vibrating, okay?
yes. Yes.
Okay, next we can also test on the medial malleolus, so we can go ahead and do your feet as well.
Yes.
Oh, hold on 1 second.
Yes.
Okay,
Yes.
good. Okay, this time the socks would be off at this time, exposing the skin for this test. After that, we can do graphthesia. So I'm gonna have you go ahead and put your hands in your lap, close your eyes, let me know what number I'm drawing.
1,
Good,
2,
good. Okay, you can open up your eyes. After that, we're gonna go ahead and do some cerebral reflexes. So I'm gonna have you go ahead and do rapid finger movement. So I'm gonna have you go back and forth as fast as you can. Good. I'm gonna have you make the OK sign. Good. Next, we're gonna go ahead and do, put your hands in your lap, and we're gonna go ahead and flip flop them as fast as you can. Good. After that, we're gonna also test. I'm gonna have you put your finger to your nose and then touch my finger. Good. Good. One more time. Good. And here we want to notice if there's any swaying or any deviation from my finger. After that, we're going to go ahead and do deep tendon reflexes. So just relax all your muscles. You're going to feel some tapping. Here we go on the ulnar surface. So we should watch the thumb move it this time. Good. Next, I'm going to test the brachioradialis. So just relax your arm. Good. Next, we're going to test the triceps. So, good. On this side. Good. Next, we can go ahead and test the patellar as well. So, just relax your legs. Good. Good. And then you can hold the feet relaxed. Good. Okay. After that, I'm going to have you go ahead and take off your socks because we're going to do the lower extremities at this time. Okay?
Okay.
Here, we're going to notice the same thing for the toes that we did with the fingers. We're going to notice any cyanosis. So here we're checking cap refill, less than 3 seconds, which is good. We're testing pedal pulses, which are strong, +2, and the tibial pulses as well, which are also +2. Here, we're going to notice any of the joints, any pain, tenderness, any deformities, redness, any edema like that there, anything not symmetrical. We're going to do some toe exercises, so I'm going to have you scoot back all the way to the edge of that. And you're going to go ahead and mimic what my finger, you can spread out your legs, your toes, curl them in for flexion, extension, bring your toes out, abduction, spread your toes, adduction. Good. Next, we're going to go ahead and assess the ankles, so any pain, tenderness, swelling, any deformities here. We're also going to do some range of motion for that. So I'm going to have you go ahead and put your foot up, dorsiflexion, point it down, plantar flexion. Go ahead and move it around. Good. I'm going to have you bring your toes in, like bring your foot in. Good. Inversion, eversion, bring it out. Good. Here we can also test the strength of your feet. So go ahead and push your foot up. Good. Press on the gas. Good. Move down a little bit. We can assess calf strength here too. So go ahead and push down. Good. Up. Good. And we can also inspect the knees next. So any pain, tenderness, swelling here. We can assess the hips too, make sure they're aligned at this time for any pain, anything like that. We can do hip strength as well, so go ahead and put your legs out. Good, together. Good, she's very strong, so that's great. I'm gonna have you go ahead and lay down. We're gonna finish the assessment, and we're gonna do knee and hip flexion. So for the knees, we are going to go ahead and start off with flexion. So this, I'm just going to move your knees so you can get the other one down. This is flexion. She'd be extending her knee like this, and then this is hyperextension. We want to see a straight line. And same with the other foot. She can flex it, extend it, and hyperextend it. No pain? Nope. And same thing, you can assess hips, make sure they're aligned. There's no shifting, anything like that. For the hips, we're going to go ahead and test flexion by bringing your foot up. For that, good. Flexion, good. When we keep your leg up, we can do internal and external rotation, good. And we can do some circumduction, making sure there's no clicking, anything like that. Same thing with this foot, internal, external, and there's no clicking or any pain. I'm gonna go in your stomach so we can finish the hip. So for extension of the hip, we bring the bent leg up, and this would be extension. Bring up a little more is hyperextension. Same with the other leg. We're gonna bring up, extension and hyperextension. Good. You can go ahead and roll over. We did our light touch sensitivity and our vibratory stuff already. So we're gonna go ahead, you can sit up and we're gonna test your spine. You can stand up, yeah. So for this, we're gonna go ahead, I'm gonna have you face me just so you can see the camera. You can go ahead and bend down here. We notice any pain, tenderness, swelling, any step-offs here of our spine. We check for scoliosis, which would be an S curvature. This is flexion of the spine. You can stand up. Support the patient's back. We're gonna extend, hyperextend, good. We can face the camera. We're gonna do lateral movements and some spinal twists, good. Next thing, we're gonna go ahead and test Romberg. So go ahead and hold your arms, close your eyes, feet together. Here we notice any swaying, anything like that here. Which Bliss is doing a good job, not swaying, she's very appropriate. You can go ahead and open up your eyes. I'm gonna have you go ahead and we're gonna assess her gait with tandem and regular walking. Go ahead and walk back and forth for me. Here, steady, no limping, anything like that. Next, I'm gonna have you go ahead and put your one foot in front of the other. Good, and you can come back. Good. After that, we're gonna go ahead and have you hop on one foot, hop on the other, hop on both. Okay. After that, you can go ahead and have a seat. We are going to move on to the neurologic exam. So here during the whole assessment, we're seeing if the patient is responding appropriately to questions, if they know where they're at. Do you know what month it is?
January.
What year it is?
2017.
Good. And what is your full name?
Bliss McLaughlin.
Okay, good. So we want to make sure they're oriented to person, place, date, and time, and to assess neurologic status. After that, we're going to go ahead and move to cranial nerve 1. So I'm going to go ahead and have you close your eyes, and we're going to do what do you smell?
Coffee.
Good. Touch your other nose.
Coffee.
Okay, good. So after that, we can go ahead and move to cranial nerve 2, which is the optic. So we're going to go ahead and use the Snellen chart. And we can also test for the visual fields and the ocular fundi. So here, we're gonna go ahead and make sure our light is on. But first, we'll start with the Snellen chart. So I'm going to have you cover your right eye, and I'm going to have you go ahead and tell me what's the last line that you can see.
LEFODPCT.
Good. Cover your left eye.
LEFODPCT.
Good. Open up both eyes.
LEFODPCT.
So a patient would be normally standing 20 feet away from the Snellen chart doing the visual acuity. Here we are going to say that she is OS, which is left side 20/20, OD 20/20, and OU 20/20. So she has good vision. No corrective lenses or glasses were used at this time. After that, we're going to go ahead and check for the optic reflex. So we're going to go ahead and shine the light in Bliss's eye. So we're going to take a look, make sure we're looking here, which there is a red reflex. Good. Okay. After that, we're going to go ahead and move on to cranial nerve 2 and 3, which is the optic and the ocular motor. So here we can also test if her pupils are pearl, reactive to light, which they have been the entire time, especially when shining the light in. We can also test that by covering one eye, shining the light in. You can just look at my nose, making sure they're reacting appropriately to the light. Good, which they're responding great. And our pupils measure about 3 millimeters. After that, we can also test near response. So I'm going to go ahead and have you look at this, and then I want you to look at my shoulder. Look at the tip, look at my shoulder. I Want to make sure that her eyes are bouncing, making sure that her pupils are reacting and changing to both objects that she's looking at and focusing correctly. After that, we're going to go ahead and move to cranial nerve 3, 4, and 6, which is oculomotor, trochlear, and abducens. So here we're going to do the 6 cardinal movements, and we're also going to go ahead and go in 6 different positions. So go ahead and look. Good. Here we're looking for any ptosis, any nystagmus, any tracing that is inappropriate at this time, which everything is normal. Also, we can check for convergence, so I'm going to have you go ahead and look at the object at the tip. We want to watch her eyes cross, uncross, making sure she's able to do that. Good. Next, we're going to go to cranial nerve 5, so we're going to do corneal reflexes, which is the trigeminal. So I'm going to have you go ahead and look forward, and we're going to feel something in your eye. We want to make sure that the cotton doesn't obviously hurt her, but we want to make sure that she's reacting appropriately, which should tear. So we're touching her cornea. After that, we're going to go ahead and do facial sensation as well. We're going to go ahead. Do you feel me touching you?
Yes.
Here?
Yes.
Good. Okay. After that, we're going to go ahead and do cranial nerve 7, which is facial. So I'm going to have you go and smile, puff your cheeks. Good. Okay, you can unpuff. Go ahead and we're going to test strength as well. Push your cheek against my hand. Good. Other cheek. Good. All right. After that, we're going to go ahead and do the acoustic. So I'm going to whisper something in your ear, okay?
44.
Good. I'm going to test the other ear. Close the other side.
Christmas.
Good. Okay, so good hearing. We are going to move to cranial nerve 9, which is a glossopharyngeal. So you can watch. Go ahead and swallow for me. Good. Make sure there's no abnormalities here. After that, we're going to move to the tongue depressor. So we're going to go ahead. I'm going to have you open up your mouth, say ah. And here we can also test for gag reflex. We're going to skip that at this time, but that's part of the cranial nerve testing. After that, we're going to move to the accessory muscles. So I'm going to have you go ahead and move your neck up and down. Good. Side to side. Good. And shrug your shoulders. Good. After that, we're going to move to the last one, which is cranial nerve 12, which is the hypoglossal. So I'm going to have you stick out your tongue. Watch and see if it's midline, and then move it side to side. Good. She's following commands appropriately, and this is the end of our assessment. Thank you.